Well, President Muhammadu Buhari approved the setting up of a health sector reform committee to commence the development and implementation of a health sector reform program for Nigeria in collaboration with the state governments and the FCT administration. Now, this is sequel to a health sector diagnostic review report developed by a consultant, Vesta Healthcare Partners, and the Federal Ministry of Health. The committee, we understand, will undertake a review of all healthcare reforms adopted in the past 2 decades and the lessons learned and factor them into the development of the new health sector reform program. Well, for more on this particular project, joining us to talk about it is Professor Titus Ibekwe. He's an ENT surgeon, a public health physician. He joins us on the program from Abuja studios. Thank you for joining us.
Thank you, Millicent, for having me.
Welcome. Despite Nigeria's strategic position in Africa, first, what are your thoughts on its healthcare system, medical intelligence, and perhaps public health?
Well, Nigeria is big in the healthcare space, and that's why the WHO and indeed all the organizations are so much concerned about what is going on in Nigeria. And again, a lot is expected also to percolate from Nigeria. Today, as we all know, we have not really reached the zenith that is expected of us. And right now, we have a lot of problems at hand. As we are currently speaking, as each and every one of us knows, most of our public institutions are really down on their knees because of the ongoing industrial action across the country. And the issue here is that there is need to wake up our healthcare system. So setting up this reform committee is a welcome development by the federal government. But at the same time, there is need because the reform committee is expected to finish its work within the next 6 months. This should be a long-term goal. We need a short-term goal to make everything possible so that the healthcare system works again. And the shortest way out of this is all the concerned parties, including the federal government and their team, coming in terms with aggrieved parties to discuss with them and ensure that our system is up again. Those who are currently striking, that their needs are met. And agreement that has been signed in the past, that are also respected so that everybody will be happy to go back to work. And once this is done, then we'll be able to focus on the current perennial problem that we have been having in the country, which is expected that the reform committee should focus their searchlight on. But let's not forget that a very similar action has been taken in 2014 by the then government by setting up the Interministerial Committee, popularly known as the Yayale Ahmed Committee. And also have eggheads, just like this group of people that made up this current committee. And in that same committee, 22 professional bodies and 16 regulatory agencies worked with them. And they even traveled outside the globe to be able, outside our country, to other globes to be able to see how developed countries who have made it well in their health space, how they're able to do this. And they came up with a white paper with 50 recommendations. I understand that about 6 of those recommendations did not go down well with some other groups in the health sector. But of course, we know that there is no recommendation that is perfect. All that is expected is a roundtable meeting to be able to resolve those issues. So most of the time, our problem is actually implementation of these beautiful, policies that we generate, not necessarily coming up with such. So we expect a lot from this reform committee, but my advice is first they should try and go through the Yayale committee report, and sieve out all the points there, and then go further to look into critical areas. One is manpower development. Manpower development, as we know today, a lot of the human resources we have, they are living in their droves. And not just that we're not producing excellent medical personnel in the country, but producing is one, and ensuring that we're able to retain them back in the country. and retrain them over and over so that, they will be sharpened in their skills, because you go to the best of the clients, best of the institutions across the globe, you see Nigerian doctors, Nigerian nurses all performing. But today, look at the number that is leaving. It will just be like a drain pipe if we don't do something urgent. Just by trying to look into, what they are asking for, looking into the incentives that will keep them back, because it takes a lot to train one.
Yes.
Beyond the looking at the, the human resource, we also need to look at our facilities, incentives that we have on ground. And we know that federal government alone cannot do it. So we need to involve the private sectors in doing this, and you give them that enabling environment. And how do you do this? Indian followed the same pathway and they were able to achieve. So you ensure that you give single-digit loans to such private sectors that are willing, that importation of, health equipment are duty-free. So when you do this, you attract much more investment. People grow confident.
I must quickly ask you, and this is before we take a break, and this is, do you think that a lack of clarity of roles and responsibilities, and this is among the different levels of governments, have perhaps compounded the situation? Briefly, in 30 seconds, if you can.
Yeah, Millicent, you're very correct here, because we know that the rivalry among the healthcare professionals is a big problem. But once I can tell you, roles are clearly defined. Everybody knows their responsibilities. There will be no problem, again, in the health sector, regarding that. But beyond that, it takes two to tango. That's why a holistic look is very important. And that's why we also look at the model of the healthcare that we also put into the system that will facilitate, an enabling healthcare system that will be able to take care of Nigerian needs. Public-private partnerships is a very important one. Concessionaire of some of our, health facilities to ensure that these private groups invest robustly, because government, as I said, does not have the financial muscle. And again, when you talk of the financial healthcare system in Nigeria, it is an area that has to be looked into. Minimum 15% of the budgetary allocation is needed to be able to have a robust healthcare system that will be able to endure in and take care of the populace of Nigeria.
Then, they have their work cut out for them from all of the things that you've talked about. Well, we appreciate your time. Thank you so much, Professor Titus Bekwe, for joining us on the program. It's always a pleasure having you.
Thank you very much, Millicent, for having me.